Hi guys, welcome to Convos of a Brunch by the Wellness Table, hosted by A Dose of Health, the podcast. We're here bringing the conversation offline to build a community where we have great conversation, learn about health, and just have a good time overall. So, karibu sana, let's go.
Welcome. We said the front seat is empty. Don't be shy.
Hello everyone. Hi. My name is Sharon Jao. I'm a quality assurance manager. Wow. I'm here today to support my best friend. I'm really excited to be here. I'm a tax expert. Anything tax, just without. Hi everyone. My name is Natalie Mokami. I do many things, but I think majorly I'm a therapist. That's my background. I'm here to support my best friend.
My name is Hope Simiu. I'm a medical doctor, certified YAPA, health advocate. You see me on Instagram, on TikTok, and I just love generally talking about health and making it simple for everyone. So today we just want to bring the conversation offline. We want to form a community, to have a good time, to learn, and to network. So you need to leave this place knowing the next person, what they do, how they can help you, because you never know where they'll meet you in the next few years, right?
Help them, for example. But very, very important as people who come from different systems, right? Meaning religion, culture, gender, right? You have to be able to understand based on the normality, right? Choosing yourself may mean that people may feel uncomfortable because it's unfamiliar and because you played a certain role that benefited them. Or maybe you're self-sacrificing because you feel like that's the only way love can be seen as acceptable. So please, kindly, when thinking about mental health, remember the environment that you're living in. So maybe that's what I would say.
So there's also an element of there's an element of taking a pause to check in on yourself to see what's happening for me in this moment when I say no, and how do I feel about it. And once you understand what is an old pattern that's being shaved off and is trying desperately to hold on to you because that's what's familiar and that's what you know, versus this is what I'm choosing for myself. I understand that this is my history, this is what I've been raised with, but this is what I want to move forward with. So the element of choice in being able to dissect what's good for me and what's uncomfortable for the other person because they were enjoying when I was overcommitting, when I was people-pleasing, etc.
People pleasers, oh yeah. And it's injected in the hospital. Yeah? That's right. So this is the one that will be injected in the hospital. And then there's a new one called Sayana Press. So Sayana Press is self-care, so you do it on your own. Yeah. So, but they work in a similar way. Okay.
I asked because I had I loved the man, but I have said it before, and it was one of the most horrendous experiences when it came to insertion. The experience in itself was enough contraception for me. So can we have, pain management, sedation, as in something for that? Because
So you have to be in excruciating pain to get a gynecological procedure done. It's 2025. There's lots and lots of options. So what we do, or what options are available? So first of all, there's pre-meds. So So there's medications, you should get a prescription from your gynecologist. Some meds to take about 4 hours before. So it's a combination of painkillers and something to soften your cervix, something called misoprostol, and then some medication to take about 30 minutes before, which has like an anxiolytic kind of thing, like Codil, for example, or midazolam. And then when you come to the clinic, I think a big part of pain control is explaining. So explaining what's going to happen, explaining the steps, saying you might feel this, you might feel that, and then not minimizing the procedure. So this business of saying, you feel a bit of discomfort, a mosquito bite, pressure, like we say it is painful. It is painful, but pain is a very complex thing. People perceive pain very differently. People's thresholds, people's previous experiences determine how they feel pain.
That the cervix is usually very tight, number one. Number two, it has a lot of pain receptors, yeah? What we call prostaglandin receptors. So those prostaglandin receptors, when you're younger, before you get babies, they are very active. So they respond very well to any pain perceived from the uterus, because the uterus will contract so that the bleeding comes out. So that element of them contracting, and even for the blood to start shedding, there's prostaglandins released by your body so that the process of breakdown happens, so that now it can come out.
When these changes start happening, and especially menopause, when it happens before the age of 40, not perimenopause, but menopause, that's when we call it now premature ovarian failure. Meaning, this should not be happening, it is not normal. There could be many reasons for that. Sometimes, in practice, actually, we've seen genetics. The reason for that, I don't know why, where you see a number of sisters coming in at 26, 30, when you do some lab tests for them that are, like for instance, AMH, that checks the ovarian reserve, you find that it is actually the age of a 50-year-old. So that has no explanation as to things like genetics.
Hi, how are you? My name is Lynn. I loved this event. I'm so glad I came. I learned that there's no cutoff for BTLs. So that's fantastic, because some of us are one and done. Just that. But this event, amazing, learned a lot. So many doctors, so many chances and opportunities to learn, ask questions, and do the most. Hope, I'm proud of you. Thank you.
Hi, my name is Paula Kivagendi. I am the CEO and founder of Spice. We do wellness shots, which is commonly known as ginger shots. I knew about the wellness table because I've worked with Dr. Hope before. We have sent her a few packages, and some of you have come and ordered from us. What I took away from today, rest is very important, because I'm an entrepreneur. We are always on the go, 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 go. But having rest is very important. Even if it's just a small tea break or taking 5 minutes to breathe, it's very important. So taking a break, not just crashing everything at once and having your last break like towards the end of the year. Just take small breaks in between, and that will help you even be more productive. So that's what I got.
What did I learn today? I learned that you don't need all 12 periods to be healthy, and by periods I mean your menstrual cycle. 3 to 4 is enough in a year. And what else did I learn? I learned that, of course I knew this, but just re-emphasis, blood clots are not normal in your periods. Please get that checked. Then the second question was, how did the event go? It went very well. A bit of anxiety at the beginning, a bit of jitteriness, but overall 10 over 10, and I do recommend it.